Good morning, everybody. It's Dr. Lori Ebert, and I am at Desert Wellness Center in Chandler with this gorgeous lady behind me who should be right next to me, but my arms aren't long enough. This is Dr. Kris Wallace, naturopathic physician. Good morning.
Hi. Such a fun day.
I know, it's very exciting. So you guys have seen me do events with Desert Wellness many times, and you guys, they moved. Their office is double the size. It's gorgeous over here, so congratulations. And your specialty is women's wellness, endocrinology, anything else?
A lot of family medicine. Actually, before I came here, I was at really a family practice. So I saw all ages, but
Okay.
I love women's health. Of course, it's my thing. I'm a girl.
Okay. Well, we'll talk a little bit more about this because I am here today to actually do the Geneveve procedure. And the Genevieve is, well, I would call it vaginal rejuvenation, but how would you describe it, Dr. Wallace?
It is vaginal rejuvenation. We are taking care of those. We're taking care of the lining of the vaginal walls, but what we're doing is we're strengthening the lining of those walls. We're rebuilding tissue, creating more lubrication, making it all brand new. And in fact, when we do that, we're making it stronger. So we're able to get rid of a lot of stress urinary incontinence, which is when you're running and peeing and laughing and peeing and crying and peeing and all that.
Little dribbles.
Yes,
little
we're stopping
dribbles.
that.
No, we're stopping that. Okay, well, we're gonna have lots of time to talk about that. But right now I'm standing almost halfway in my birthday suit. So I'm gonna turn this around and she's gonna get me set up and then we'll ask more questions as we go along. How's that?
Perfect. This is the grounding pad.
Okay.
So we use radio frequency for our treatment. So we're gonna put this, we usually put this right behind on the bud, and that keeps everything working properly, especially in terms of the radio frequency. So it's important.
And we're gonna talk more about what that is. And then here's the machine right here. And then you'll show everybody what the wand is and what you do as you do it. Okay, so it's really pretty simple. I just have to clean off a spot so it's not greasy, and that grounds it.
Yes, we want it on there.
Okay.
And we're just gonna lay on that so that it stays on there nice and sticky the whole time.
Okay.
We're gonna get started. This is what the tip looks like.
Looks like a toothbrush.
It does. Looks like an electric toothbrush.
Is that whole thing going in there?
Nope. It's vaginally. It's only going to go into about this part. So it only treats the introitus and the very first part of the vaginal wall, because that's the part that gets lax with age. And it treats the lining all the way around. So we're turning this. This is the actual tip. We're turning it as we go. And we actually make 5 circular passes. So we get to know each other really well because we're in here about 30 minutes doing this. Sometimes we play music, but with Lori we'll probably just chit chat. There is heat involved, but it's cryo-cooled, which makes this treatment really amazing and really pain-free. Sometimes if you have a little bit of scar tissue, let's say you had an episiotomy when you had children, you might feel it a little bit more, but it goes from like a 1 out of 10 to like a 2 out of 10.
So it looked bigger on the camera than it really is. So see that, you guys? It's just about the same size as your finger.
Yeah.
Okay, fantastic. So it's not going to hurt.
Mm-mm.
All right, so she's going to put a lot of lube on.
Yep, there's a lot of lubrication that goes actually on the wand, and then we're going to use lubrication on you too.
Okay, got it. So it sort of just feels, yeah, I can feel the heat a little bit, but not hot.
Shouldn't be very hot at all.
It doesn't feel much different than having a tampon in, but like you feel a little heat, but then it feels cool.
But then it goes, because it's cryo-cooled the minute it starts. The cryogen goes in there and cools it off.
Wow. So the cool kind of tricks your mind.
It does, totally. Okay. If you are having leakage when you're trying to exercise, urinary leakage when you're exercising, when you're coughing, when you're laughing, jumping up and down, sneezing, any of that, if you're having urinary leakage when you're having sex, this is definitely the program for you. This is what you need to have done. So as estrogen leaves your life, which it will naturally, starting maybe even age 40, 45, for sure by 50, now you don't have collagen building as well as you should. And collagen is what brings the lubrication. It keeps everything lubed, including like your skin. You notice your skin gets drier, your scalp is drier, all that, everything's dried up. Ugh, so annoying. This helps rejuvenate the tissue, so now you have more lubrication, which is always comfortable.
Painful sex is a huge problem. Does this help address some of that?
Oh, of course, because why is it painful? It's painful because it's dry. It's painful because you have to have so much thrusting or movement to feel anything because there's laxity, right?
You guys see why I like Dr. Wallace? Because I'm like this bold person out there talking and she just lays it out because that's what's happening.
No, it is. People are like, what? Did she say thrust? But it's true.
Yes.
So if you can get everything tightened up in there, obviously you're not going to have quite so much movement, not so much jarring. and all of that. You should feel the difference and some changes within a couple of weeks. The stress urinary starts, you start noticing differences. Within 3 months, you'll feel all the changes, 100%.
So why wouldn't people do this? Seriously, it's there. So, and that's part of what you're doing is bringing the word out because women just don't know. So that's why we're talking about it. That's why we're showing you guys, because you do not have to live with painful sex. You don't have to live feeling like you're crazy. You can really enjoy being a woman again.
Yeah, or peeing your pants all the time.
That's why we want you to feel sensational. All right. Thank you, Dr. Wallace.
Yay.
Bye.
Thank you. Bye.
So I want to tell you that by day 3, I noticed natural lubrication coming back. I couldn't believe it. Now, I'm not having terrible problems, but I just didn't really know it was missing until it came back. And I just noticed like, wow, this is how I used to be. Like, this was me. Where did it go? And now it's back. And I was just shocked. I'm like, well, maybe that was just a one-time thing. But that's been consistent every day since day 3. I cannot believe the difference. And it's only been 7 days. So if you have vaginal laxity, if you've lost your natural lubrication, if you have any kind of dribble, any kind of leakage when you laugh, when you sneeze, when you get up, or urinary leakage during sex, I'm only 7 days in and I highly recommend the Genevieve procedure. So it is simple, it's quick, it's 30 minutes, it does not take a lot of time. It's a one and done. So ladies, if you don't feel like yourself and feel like you're going crazy and you want to feel like you were 30 again in every part of your body, especially your vagina, then I recommend the Genevieve. And check out Dr. Wallace, Dr. Kris Wallace at Desert Wellness Center in Chandler, Arizona. Thank you, Dr. Wallace. I'm so excited to have all my juiciness back.